Welcome to the podcast entitled Health and Wellness Briefs, Tactics for a Healthier and Better You. I'm Dr. Bern Melnick, Vice President for Health Promotion and Chief Wellness Officer at The Ohio State University. This podcast series is brought to you by my CWO office and wonderful Buckeye Wellness team in order to provide you with the evidence-based micro-learning modules to optimize your health and well-being. Our podcasts start by taking a dose of vitamin G. Given that vitamin G, or gratitude, is one of the simplest research-based strategies to improve mood, sleep, and optimism, and reduce stress and blood pressure, please take a few seconds now to think about who or what you're grateful for today. Then give a dose of vitamin G for even more benefit. Today, I'm excited to introduce our guest, Jody Leister, who is our wonderful director of our Employee Assistance Program at Ohio State. Jody is a wonderful mental health expert, and she is very skilled in crisis intervention. Welcome to the podcast today, Jody.
Thanks, Barn. Thanks for having me.
We are going to talk today about depression, how to recognize it, how to deal with it, and very importantly, how to prevent it. Jody, both you and I are very passionate about this topic. And
Yes.
The first question that we're going to answer today, how do you know if you're truly suffering from clinical depression? Because it's really skyrocketed during the COVID-19 pandemic.
I completely agree with you. It has skyrocketed. We've seen astronomical increases in individuals seeking help, which is a really great change. And it shows that there's been a lot of destigmatization for help-seeking behaviors. When you think about depression, the main things we think about with clinical depression are the frequency or how often the symptoms occur, the intensity or how deep the despair is, or how sad you may be, or how much your functioning is impacted, or the duration, so how long these symptoms last. So for clinical depression, individuals will experience a myriad of symptoms, all different types of symptoms affecting different parts of their life and their functioning, but it needs to be at a significant level that it's interfering with their functioning, and then for a minimum of 2 weeks. And that would meet the basic clinical idea of what depression is. But for most people, it doesn't fit that neatly into a category. It often starts in a very slow creep. It's insidious. So it's an overall just feeling low energy, a lack of interest in things. And when you notice that you aren't able to kind of pull yourself out of it, or if you notice that you're spending more time in that state than any other, that would be an indication to you that this has reached a point that I should do something about it. It's not just something that would be a typical response to a stressor in your life.
Jody, I want to emphasize that too, because I think that big red flag is if you're experiencing sadness, hopelessness, mood that's really negative, that's interfering with your ability to function, interfering with your judgment, that's clearly a red flag. And I want to mention it's a strength to recognize we need help. But sadly, stigma is still alive and well out there. But if somebody is struggling again, what's the first step? What do you recommend they should do?
For my practice with individuals that I work with, and not just within OSU, but for the last 16 years or so, the first things that I recommend for people are to start with the basics, things like managing your diet, managing your sleep cycle, and then hydration of all things. As a chronically dehydrated person, I'm very aware of how much it really does affect mood and it affects so many aspects of your life to be appropriately nourished and hydrated and rested. So those are the most foundational things that I think any mental health professional is going to say to start with, but then also talking with a professional, just talking about the elephant in the room and saying how you're feeling, because the likelihood is that you're not alone. Many of us just don't know how to talk about it or choose not to because we think that we're alone.
Right. And as a first step, people are usually being seen by their primary care provider. And you're more likely often to feel more comfortable, at least opening a conversation there. So I advise people all the time, you want to see somebody who can do a really good assessment. There are some fuzzy lines between seasonal affective disorder and depression. We've experienced grayness here where we live for the last week. So can you talk about, again, some of the differences between seasonal affective disorder, which a lot of people experience in the wintertime, versus clinical depression?
Absolutely. You're absolutely correct. So here in the Midwest, and especially in Ohio, we experience a lot of grayness. And a lot of that is actually related to daylight savings time because it really upsets our circadian rhythm. And that goes back to what I said previously about sleep being so important. Sleep is our way that our body restores itself. It's how our brain grows. It's how we synthesize information we've learned throughout the day. And it's how we rest. So for seasonal affective disorder, it has a lot of pretty much all of the symptoms overlap with depression. The main difference that you see with clinical depression and seasonal affective disorder is the onset and the duration of those symptoms. So a lot of times you'll see it specifically start to rear its ugly head when we start seeing things like daylight savings times change if you live in the Midwest, like most or in most of the United States, or if you see big shifts in the climate and weather, things like that. We need vitamin D. Vitamin D is one of the ways that we produce our body's natural feel-good chemical. So it helps us to manage those symptoms of depression and it helps us be more active. So for seasonal affective disorder, the symptomology is the same. However, you'll see that as the seasons change, as the temperature gets warmer, we get more time outside, more daylight time, that mood naturally starts to elevate because we're having those reduced cortisol levels. And then we're also having an increase in our dopamine and physical activity. It's like the world shuts down in winter.
Absolutely. And you make a great point about vitamin D. I really encourage everybody who experiences gloomy, cloudy winters, especially, to ask for a vitamin D level. And I have had to go on high vitamin D supplementation a few times. And I think it's really an important point to emphasize. If you haven't had your vitamin D level checked recently, next time you go to your healthcare provider, ask for a level to be drawn. You talked about sleep and how important it is. But I also want to talk about the therapies that are evidence-based. So if you're clinically depressed, it's well established in the research literature that cognitive behavior therapy or interpersonal therapy are the two most substantiated research-based effective treatments. So, what do you advise people if they reach out to a mental health counselor in terms of what's their expertise to deal with depression?
That's a really great question. So cognitive behavior therapy and interpersonal therapy are extremely effective treatments for depression and evidence-based, of course. When you're looking for a provider, you can, of course, look for someone that has those specialties identified within their website or within their scope of practice. If you're able to look through your insurance website or look through your insurance directory for that. But a lot of the focus for depression is psychoeducation of understanding and the individualistic cycle of depression and how your thoughts and the way that you relate to your thoughts and then behave accordingly help to either alleviate or intensify those symptoms. And then it also focuses on relational patterns and things like that. So really, it's not a one size fits all. You can absolutely look for providers that have specific treatment modalities for interpersonal therapy or cognitive behavior therapy. Looking for somebody that has a multitude of different settings, different diagnoses that they do have the ability to work with, because often depression is so complex and so multifactorial and layered within an individual. That's one of the things you can take into consideration when you're trying to find someone. But if you don't find the right fit immediately, don't be discouraged. It's a very special relationship that you have with a practitioner. So you have to connect with them. And once you find the right person, you'll be surprised how quickly that relationship can be very transformative with helping you to build a better relationship with yourself and also to just address any of those symptoms that you have.
Absolutely. As an expert in cognitive behavior therapy myself, it's really important to really dig into the deep root causes of the depression. If it is an unhelpful or negative pattern of thinking, the skills that are taught in cognitive behavior therapy, like catch, check, and change your thoughts, can really, really help. But that takes practice repeatedly to become aware of these unhelpful thoughts. If the root cause of depression is really negative or unhelpful patterns of thinking, you don't learn to catch, check, and change these thoughts, the recurrence rate of clinical depression is super high. It's 60 to 70%. So again, it's important to talk to your therapist, to your provider about what you're experiencing so they can help to determine what type of treatment is best. I want to finish our podcast with the focus on preventing depression. Latest studies have come out, Jody, that have showed exercise is such an effective treatment for depression. So would you talk about that a little bit more and other strategies to prevent it?
Absolutely. Exercise is one of the most effective things that you can do to manage your mood overall, not just depression, but anger, anxiety, any mood that you might experience, because it allows you to physically express that experience that you're having. For exercise, it lowers your cortisol levels, which helps you to increase your serotonin production, which is, again, is one of your body's natural happiness drugs and key to depression. exercise itself is very intimidating for a lot of people. When I meet with clients and with individuals, I help them to understand that there's a difference between exercise and physical activity. Exercise is usually very repetitive, and for some people, that's really great. I am personally a walker. Walking is one of the most effective forms of physical activity or exercise if you make it in the intervals and timeframes to make it qualify as such. But walking is one of the biggest things that I encourage people to do, especially here in Central Ohio. We have an amazing Metro Park system that is available. I personally work on campus, and we have the Chadwick Arboretum, which I know it's an OSU specific resource, but they have a labyrinth there that's so wonderful to get some physical activity and then also to help in a very meditative way. But consistency is going to be the most effective thing with managing any of this. So consistent exercise, consistent physical activity, consistent sleep habits, consistent eating habits, because you create that muscle memory, if you will, in your system, and then you build your internal resilience too by utilizing those cognitive behavioral skills, getting that exercise consistently, getting outside in that sunlight, especially for seasonal affective disorder, starting your day off with a morning walk. It does wonders for your spirit and for your body, but it clears your mind. It gives you that burst of vitamin D, helps you produce that serotonin. So exercise is key, but be gentle with yourself too. If you're new to exercise, ease in, focus on physical activity. Maybe you have a lot of children and doing lots of laundry is very physically laborious. I don't know, but focusing on getting some movement, because movement is what we need. Depression makes us sedentary.
Great advice, Jody. So with that, I'm going to wrap up this podcast. Thank you for tuning in to Health and Wellness Briefs. Tune in to other podcasts in this series to learn more evidence-based tips for a healthier and better you.